Do you know what tuberculosis is and how it affects the body? Tuberculosis, often referred to as TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Although it primarily targets the lungs, don't be fooled. This stealthy bacterium can potentially affect any part of the body. This disease is a master of disguise, existing in two forms: latent TB infection and active TB disease. In the latent form, individuals are infected with the TB bacteria, but they don't show symptoms because their immune system is keeping the infection under control. On the other hand, active TB disease is a different ballgame. This occurs when the TB bacteria multiply and the immune system can no longer control the infection. Active TB triggers symptoms and can cause significant discomfort. Now let's dive deeper into these two forms of tuberculosis, latent and active. So, what is latent and active tuberculosis? Let's delve into that. Latent tuberculosis is like a sleeping giant. Here, individuals are infected with TB bacteria, but they don't show any symptoms. Why? Because their immune system keeps the bacteria in check. But here's the kicker: about 1 in 10 people with latent TB may wake this sleeping giant, developing active TB over time. Now, active tuberculosis is when the TB bacteria decide to throw a multiplying party, and the immune system can't gatecrash this party to control the infection. This is when you start to see symptoms. You might feel unusually tired, lose weight unintentionally, or battle fever and night sweats. Appetite might take a hit, and a persistent cough could set in. If it's pulmonary TB affecting the lungs, you could be dealing with a bloody sputum and chest pain. Remember, TB is primarily spread through the air when a person with active TB coughs, sneezes, speaks, laughs, or sings. So how do we diagnose and treat this disease? Diagnosing and treating tuberculosis is a critical step in controlling its spread. The diagnosis of TB employs a variety of methods, including the tuberculin skin test or blood test, a chest X-ray, a physical examination, and a sputum culture. Once diagnosed, treatment options are readily available. Antibiotics are prescribed for both latent and active TB. It's crucial to emphasize here that completing the full course of treatment is vital to prevent the emergence of drug-resistant TB. Now let's touch on prevention measures. The Bacille-Calmette-Guerin, or BCG vaccine, plays a significant role in preventing severe or life-threatening TB disease, particularly in young children. However, this vaccine is not part of the routine national immunization program in some countries, like Australia, and is recommended for specific groups. It's essential to consult with a healthcare professional if you suspect TB symptoms or have been exposed to an infectious individual. Early diagnosis and proper treatment are key to managing and preventing the spread of TB. Stay informed, stay healthy.